Okay, guys, I have discussion D for you. This one we're discussing alternative therapies for Alzheimer's disease. Okay? For patients considering alternative therapies for Alzheimer's disease with a with a disease as difficult as uh, with a disease as difficult and devastating as Alzheimer's disease. We want to do everything we can to delay and prevent progression. Not not everything marketed not everything marketed for memory and other symptoms of the disease. However, it is actually proven to help. The Food and Drug Administration, with the help of neurologists and experts, scouts medical data presented to it to weigh such claims before approving a new medication. Then, after approval, medications have to maintain quality standards under strict criteria to ensure that patients get the dose they're expecting without contradictions. Dietary supplements or medical foods, while they might be popular, don't have to meet the same standards. So active ingredients, dose, and safety are not certain. There is also potential for interactions with prescription medications. Omega-3 fatty acids, hyperzine A, and synthetic coenzyme 10, Q10, have been proven in clinical trials to be no better than a placebo, i.e., like sugar pill for Alzheimer's disease patients. According to the Alzheimer's Association, the organization also warns about the lack of research supporting any Alzheimer's benefit from what is known as coral calcium, coconut oil, capraeic acid, sold as the medical food axonia. Vitamin D deficiency is linked to increased risk of developing cognitive impairment, but studies have not shown that supplements help patients with Alzheimer's disease overall. However, there are some things that might help. Related video. Could common medications be quietly raising your risk of dementia? Common drugs for things like anxiety increase your risk of uh, dementia. Okay. There is at least some evidence suggesting a delay in progression of Alzheimer's disease from an overall healthy diet, smoking, sen, uh, cessation, and acupuncture. There is also some evidence to support vitamin D supplements in reducing loss of ability to do daily activities known as functional decline, but without a benefit from or for thinking and memory. Ginkgo biloba otherwise has some limited evidence supporting cognitive and functional impacts in established Alzheimer's disease, although clearly proven not to help to prevent or delay the condition in people with mild cognitive impairment. Physical activity appeared to help stabilize overall thinking and memory in a small trial. Physical activity is linked by the American Heart Association. One of the most, one of the seven most important factors in brain health, and the findings from a number of small trials pooled together suggest that yoga benefited memory and other aspects of cognition among Alzheimer's patients. Read previous installments in the series. For your patients, what is Alzheimer's disease? For your patients, how is Alzheimer's disease diagnosed? For your patients, the stages of Alzheimer's disease. For your patients, what to expect with early stage Alzheimer's disease. For your patients, navigating treatment options in early stage Alzheimer's disease. Medical Journeys is a set of clinical resources reviewed by doctors meant for physicians and other healthcare professionals, as well as the patients they serve. Each episode of this journey through a disease state contains both a physician guide and a downloadable, printable patient resource. Medical Journeys chart a path each step of the way for physicians and patients, and provide continual resources and support as the caregiver team navigates the course of the disease. Okay, guys, so that is D for you. I'll be back on later with E, so give me a little bit to put that one together for you, and I'll be back on with that shortly. For now, Gator Wellness, take care, folks.